Hi guys, Nurse Nikki here at City Facial Plastics. I wanted to talk a little bit about my favorite treatment, and that's neurotoxin injections. So neurotoxin injections, they're primarily used to soften the fine lines and wrinkles on our face. They can also be used for non-cosmetic reasons, such as like chronic migraines, anything like overactive bladder, muscle spasms, and hyperhidrosis is a popular one as well. The most common areas that we treat, it's between the brows or the frown lines, our glabella muscle. We like to use it for the horizontal lines on our forehead, and that's our frontalis muscle. We also like to use it for the pesky lines on our crow's feet. We like to also use it for the bridge of our nose, the bunny lines, or the nasalis muscle. So those are the most common treatment areas. Two of my favorite neurotoxin brands, they do the same exact thing, but they're Botox and Dysport. Both take 14 days to see the maximum results. The only difference is the onset of Botox. It usually starts between day 5 and day 7, and Dysport starts a little bit sooner, between 3 and 5 days. A lot of my patients do tell me that Botox gives a more frozen look, while Dysport can give a more natural appearance. So it's just based on preference and what you prefer and what your goals are. To maintain long-term results, you will need follow-up injections, and we do like to recommend that you do this 4 times a year. I like to recommend to my patients, I've been doing Botox for 10 years myself, and I always start with Botox twice a year, and then I switch to Dysport, just so our muscles don't get used to any one product, and that's what I've felt to be most effective. In addition to those using this treatment to reverse the signs of aging, I also have patients as young as 20 years old using it for its preventative power. So the creases that we make in our skin every day, just by daily facial movements, eventually those creases will deepen over time. And the Botox, when it's placed under the skin, makes those muscles grow weaker and less resilient over time. So how does neurotoxin work? So essentially the injection itself, it blocks the transmitters from the nerves to the muscles. And when it's placed under the skin, it temporarily paralyzes that muscle. And that essentially gives us that overall youthful glow and softening effect that we're coming in for. What to expect during your procedure. So it's your first time getting Botox, and any kind of procedure, no matter if it's something simple like this or more complex like surgery, it's always a little bit apprehensive before the procedure. But something like this, it's very, very simple. You don't need any kind of anesthesia for the procedure, and it should only take a few minutes. So on the day of your appointment, you can opt to have a topical numbing on the treatment area, but a lot of people opt out of that because it's really such a comfortable procedure. The only time we would use a numbing is if we're doing a treatment for hyperhidrosis. So that's something for like the palms of your hands, soles of your feet, or under your arm for your armpits for the excess sweating. And typically people opt to have the treatment area numbed because that's a more sensitive area. Okay, so Precare instruction. If consent is given from your medical provider, it's very important to avoid blood thinning medications such as ibuprofen, Aleve, vitamin E, any kind of fish oil, things like that. It's also very important to avoid alcohol. I like to say 2 to 3 days prior if you can help it. And then the morning of your appointment or afternoon of your appointment, just make sure you have a meal, a really good meal. And if you can help it, just skip your morning coffee. And that's just to prevent bruising. It's just an extra little step there. So the number of injections, that's what everybody wants to know. How many times are you going to prick me, Nurse Nikki? And there's no right answer, right? So the number of injections, it actually depends on your muscle strength and your unique anatomy. No two faces are alike. So what kind of works for your friend that came in for a treatment? It's not going to work for you. I have to assess you individually, and then that's how we know how many times I'm going to prick you. But I promise you, it's a very easy treatment. I have some non-pharmacological things to kind of distract you. I like to use like little squeezy balls. I like to use a little facial vibrator. And then honestly, like I need my hands, but if I could hold your hand through the process, I would. But I promise you will not need it. It's very simple. So what I like to do for my patients before I get started, I always take before photos And I do that just to track your progress. I always ask if you'll prefer a topical numbing, which most people kind of opt out of that because it's very easy treatment. And then the next thing is when you're sitting in my chair, I'm going to ask you to make various facial movements, and they're kind of funky. I always say frown. I can't really do it because I have some product left, but frown like you're really angry with me, and then raise your brows really high. I can do that one. I need more product. And then I ask you to make a big cheesy smile so I can see those pesky crow's feet that we're looking to get rid of. While I'm doing that, I'm actually marking your skin so I know exactly where to place the product. So it's a very precise procedure. After determining your unique anatomy, I like to place you in my chair and put you in a comfortable position to where I have easy access to inject each of my markings. So what to expect after your procedure. So after the initial procedure, you're gonna have these little fluid vesicles across your forehead or around your eyes, the crow's feet. That's just the fluid under the skin, and that's going to dissipate over probably about 10 minutes. You can return to your normal activities right away, but just keep in mind, no strenuous activity just for the day, and then no alcohol, no rubbing or manipulating the medication at the injection site, and no facials for 24 hours. So like any cosmetic procedure, this procedure is still going to be tailored to your specific face. There's no two faces that are alike. You have a unique anatomy that I am going to assess in the chair. It just all comes down to what your goals and expectations are for your aesthetic and rejuvenation journey. So if you want that refreshed, youthful glow, Botox is a great option for year-round treatment. If you want to stop the progression of aging, you can pair it with various other treatments for your face, and that's things like dermal filler or even surgery. So thank you guys for watching. I hope you enjoyed the video and learned something new. Don't forget to like and subscribe, and I'll see you guys in the next one. Bye.